And Dr. Holmes, tell us about the goals of the North Carolina Metamorphosis Project and how this particular initiative aims to improve health outcomes for, again, adolescents across our state.
Sure, thank you. About 3 or 4 years ago, the Duke Endowment funded the North Carolina Metamorphosis Project, created it to look at developing policy recommendations, looking at adolescent health in North Carolina. The Duke Endowment looked around and said there's a need for an investment to try and bring people from across the state together to talk about what are the needs in adolescent health, what do we need to invest in, what do we need to be changing or creating. And the group of about 50 people worked together to come up with a report that outlines some of the priority recommendations in the that North Carolina should be looking at over the next 10 years to invest and create and improve the health of not only the adolescents, but help them become young and productive young adults as they age out of the adolescence period. So over the next decade, one of the now that the report is complete and we've done some other work and data and research analysis on that, now the hard work begins to a large extent is implementing those recommendations and talking about them and building coalitions and communities, as Jessica mentioned, together and collaboratives to work together to find these to implement these policies and improve the health.